folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
Today, Brad, we're going to talk about instant headache relief in seconds with self-massage and stretch techniques. You look like you don't believe me.
No, I do, as a matter of fact, because we have another video similar to this, and we've got a lot of good comments with people saying, wow, this has really been helpful. So we thought we'd do another one with a little more information.
Right, a lot of headaches start in the neck, and a lot of headaches are due to tension headaches.
Sure.
So this, in that case, this is where you want what things you want to try, because a lot of tension headaches start with a lack of blood flow.
Sure.
You're working on your desk and you're not moving at all,
right.
So the blood doesn't flow as well, and so
and then
things
posture
happen.
may
Right.
limit that as well, because that's a common problem. But wait, Bob, yes.
Yeah, we have a guest. We have another guest right here too. If you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also go to the Facebook and like us, because Brad and I, as children, were not liked, and we're trying to turn things around. Just go to Bob and Brad on Facebook.
There you go.
We're thinking about doing Instagram too.
Oh, that.
You don't even know what that is, Brad.
No, I'll learn someday.
All right, the reason a lot of the pain often comes from headaches, maybe bring over.
Yeah, we're going to get Sam involved.
Got to show the prescription glasses.
Oh, yeah, look at this. See that?
Brad thinks that's
Prescription
just
glasses,
funny. He
yeah.
thinks it's funny.
It killed me when the first time
All
I saw
right.
that.
One problem area that often can give you headaches is the greater occipital nerve.
Sure.
And that's a mouthful, but it comes between, I don't know which one is going to be better to show on here. This spine is in the same position. You got 7 vertebrae that make up the neck.
Right, so we're looking at here.
The greater occipital nerve comes right between the first one and the second one. It comes out and it goes up into the head. So these are the headaches that you might get that come up into on the side of the head, go into the behind the eye, can even be in the frontal area here a little bit too.
My brother-in-law used to call that, when he had headaches all the way around, he called it a full wrap.
A full wrap?
Yep, they had a full wrap if it went all the way around. And then, the idea, and what we're going to do here is that oftentimes the headache will centralize, like leave the forehead and then come back to here. And if that's what's happening, typically it's a good sign it's going right.
These are real simple techniques. These are things, it certainly doesn't hurt you to try if you're having neck pain.
Right.
And we're certainly going to not injure you by doing these. So the first one, Brad, is very simple. All you're going to do, do you want to, well, maybe I'll do this one, huh? You're going to go ahead, because a lot of the pain originates back here, even though it's going up and around here, you're actually going to just do little circles here along the base of the spine. You're going to work your way, start in and work your way out.
I don't even have a headache and it feels good, Bob.
Yeah, that's right.
I'm showing them the profile. Can you get my head and Bob's head at the same time? You got enough view there?
Lord.
What was that?
She doesn't have your head?
Yeah, well, that's probably all right.
All right. The second one is more of like a spleen massage. So this one, you're going to go ahead and just put your fingers together and then pull apart like this.
So you're actually going to feel your skin feel like it's getting stretched as you go apart. It's amazing, but if you haven't done that before, you'll probably find it very relaxing.
Let's throw a posture tip in here, Brad, because if you do all these and you still are sitting there with poor posture, it could come right back again.
Right.
So one thing you want to make sure you're doing is correcting your posture when you're seated. You can do chin tucks. We'll be doing some of those as an exercise later.
Typically, the poor posture, we talk about this a lot, is head forward posture. The whole spine gets involved. The low back rounds out, head comes forward. You're looking at your computer, the
shoulders
TV.
round forward.
Right, so you need to get up like this and work on some chin tucks like Bob had mentioned. And while you do the chin tuck, we're going to have this, then you can actually throw in the exercise.
Yeah, exactly. And that's what we're just leading to, is that now, along with the chin tuck, go ahead and do the massage. You can go ahead and do the circular massage or the spleen massage while you're doing the chin tuck. You're getting a double benefit here. You're correcting your posture, and it just has a different effect. Wouldn't you say, Brad?
When you do that chin tuck, it puts those muscles on a little bit of stretch, and that can be helpful. You can get deeper into those muscles. They're not real thick muscles, except for when you get below the occiput. They do get a little deeper, and you can feel that. And you'll know, because when you hit the right muscles, you're going to feel that release. And sometimes it's a little higher, and sometimes it's a little lower.
Another thing you can do along with that, Brad, is you can actually take your fingertips like this, like this. You're back on me, Lonnie. Lonnie's going to be busy today.
Yeah.
And you can actually spread apart like this and go down like this. at the same time.
So he's bringing his head back into extension.
Into extension
Right.
while I'm doing the spleen massage. This one feels really good, Brad.
I'm doing it, I know it. Matter of fact, maybe we should just stop the camera for a while.
You
and
concur?
Practice.
I like that word. You concur?
Yeah.
All right. The next one is a little different, Brad. Now, C1 and C2, that's where the greater occipital nerve comes out through. And sometimes one of those might be a little stuck.
So C1 and C2, we're talking about the top two vertebrae right below the occipital.
Now that, I don't know,
skull.
bring your pen on over
Oh,
here,
yeah,
Brad,
the
if you
pen.
would. Lonnie, tell us where you can focus in right over here. Tough one to do?
All right.
She's got it. Okay. So here's C1 and here's C2. The nerve comes out between there, and sometimes these get a little bit stuck. And so you see this, how this transverse process really sticks out?
It's like bat wings. They do get wide, and you can actually feel those.
You can actually feel them, and that's what we're counting on, the fact that you might be able to find that. So if you go ahead and it's kind of like right below the tip of your ear, right behind the tip of your ear, you'll reach back here, and even if you don't feel it, I want you to try it there. Lonnie's trying it even. I want you to put your finger right on there, and then turn towards that side while you're doing it. And if that's a little bit stuck, you can actually break it loose a little bit and get a little more mobility there.
Actually, when you turn your head, that's when I can feel it the best. When I get that movement, then I can feel that little bump.
I can feel it sticking out.
This is one of those things that if you're the layperson, it may be hard to find. And it depends on how much muscle. If you're one of those manly men that has no shoulder, it goes from here to here, big, massive neck.
It's not my problem.
Yeah, mine either. But those people are going to have a little bit harder time getting through that soft tissue.
I've had people actually. What I did is I put a piece of tape there for a while for them to actually find this.
So they had a landmark,
a reference point,
sure,
so they know where it is. But you can try. I want this to be pain-free, though. That's the key here.
Right.
If you do this and like, oh, absolutely not.
Right.
And you can do it one of two ways. You can find the spot and turn toward it, or you can find the spot and turn away from it. Either one might, help you out. And you can try the other side. So again, I'm off to the side. I'm behind the ear, right around in this spot here.
Maybe I should just take a marker and put a marker on there.
Yeah, I'd really appreciate that, Brad. If you
Sharpie would work good.
It's like those guys that fall asleep and everybody puts marks on their face and they wake up and don't know it.
You had that happen to you, didn't you?
Yeah, many times. Okay, if you find that to be very difficult to do, we'll give you an alternative. You can actually try using a towel to do this.
Well, the towel for a therapist is like a hammer for a carpenter. They just use them all the time.
This one's all dirty. What, it must have rubbed off one of the...
Just turn it over, Bob. It's not a big deal. It's clean on that side.
Okay. So you're going to take this, is it salvage?
Seminole common. It's S-A-L.
We're always wrong. Why can't we remember this?
The edge of the towel, I like
It's the edge of the towel.
Now you got it all wrapped up.
I think you did it.
That's because that's the way I do it. I do it a little bit different than Bob, but it works good either way.
All right, so what we're going to do, we're going to go ahead and get this salvage underneath here someday. You want to give me a hand?
You got it. You got it.
I got it finally. Okay, I'm behind, underneath the ear. And what you're going to do, that's actually going to push on that C2.
Turn around, Bob, so we can see the salvage. Yeah, see how that's right here, just under the ear. So that bone there, the big occiput's there, and they're right below it. And he's got that taut, so you can get some pressure on there.
And I have it up around by the level of my eyes.
Yep.
And so what I'm going to do, to work on rotation to the right, I'm going to drop this arm, and to the other way, I'm sorry. Drop to the left, to the right. I'm going to drop this arm, go like this. And I'm really doing well today. And then pull like this.
So this one pulls straight down, it anchors, and this one is assisting with the stretch. You notice how he has it above his chin, right about...
I'm not going like this.
Yeah, you can't breathe very good if you go below the chin.
And believe it or not, this sometimes helps headaches. And one of the ways you can tell whether or not it might help, if you look in the mirror and you try rotating, and you don't rotate as far in one direction,
right.
So you go one. You might have to have somebody to look at you to tell.
It is a little easier to have someone help you out.
So, all right, if you're going to go the other way, I'm going to go to the left now. I'm going to put this one up here. I'm going to switch hands again. This is up by the eyes. This one's pulling down. I'm going like this. The other thing is make sure the shoulder's not coming with you.
Right, these stay stationary.
Yep.
We're going to hold those.
I have seen this help people with headaches, believe it or not. A strange thing, but it actually does work sometimes.
And if it doesn't do that, it's a great stretch just for that neck rotation. It's comfortable.
Why don't you show towel extension, Brad?
Okay.
Since I was doing so well.
Well, you can do it the same way that Bob does with the selvage or the edge of the towel. I usually do it this way, and I twirl it up so it's a little round. There's a little more cushion there. But either way works good. You do it the way that helps the most, and these should all feel good. If they don't give relief, you want to go to the next one and try the next option.
If it's not helping decrease your your headache, it's not something to do.
Now this actually works better with a chair with a backrest, so you can lean back and relax. But I'll show you the basic technique here. And sometimes I'll just do this. And if you get relief with that, that's fine. But oftentimes if you go up and put a little traction so that your thumbs, when you're holding on here, are pointing right to your eyes.
So you can do some extension and then also throw some traction.
Right, so I'm pulling up that way.
Yeah.
I'm not pulling hard, it's gentle. Everything here is nothing aggressive, but it should all feel good, and it does. Right now, I'm very relaxed, and I'm getting a nice stretch, and I feel like things are relaxing in here, and it feels good.
Sometimes just taking an ice pack, too, and putting it right on the back of the neck can actually help with the headaches, too. So that's something else to keep in mind. So
if you sit in a softer chair like a recliner, those are really nice to trap the ice pack and relax back and relax into it. And,
give these a try. See if any of them help you. And we always appreciate the comments below, right?
Right. Yeah, so, we do read them.
Okay, thanks for watching.